start. So, Assalamu alaikum and good morning, good afternoon, good evening, based on wherever you are joining from. And my name is Sarfraz Husni. I'm Director of Lupus Clinical Research at the National Institute of Health here in Bethesda, Maryland, United States. And it's my distinct honor and pleasure to welcome you once again on behalf of the APPNA MERIT committee, where we are talking about the healthcare research scenario in Pakistan. And today we will be listening to two wonderful presenters, Dr. Ziaul Haq and Professor Dr. Zohaib Khan. So Dr. Ziaul Haq is the youngest Vice Chancellor and Pioneer Professor and Dean of the Faculty of Public Health and Social Sciences at Khyber Medical University in Peshawar, Pakistan, which is one of the largest public sector medical university in Pakistan. He's also a visiting professor at University of Glasgow in UK. He is regarded as one of the best public health brains in Pakistan and has received HEC's country's Best Researcher Award and also Lifetime Achievement Award and the Best Teacher Award. And he has done his MBBS and MPH and PhD and PhD in health from Pakistan and PhD from University of Glasgow in UK. He's also acquired exceptionally high research funding from multiple agencies in US and from US, UK, and other places in the world. And in recognition of his contribution to public health and education, he was awarded visiting professorship from University of Glasgow. The second presenter is Dr. Zohaib Khan, who is a public health specialist with a doctoral degree in public health from the University of Bremen and a postdoctoral certificate in from Germany. And he's currently director of the Office of Research and adjunct office associate professor of public health at Khyber Medical University. And of course, their bio is long, and I'm not doing justice in this couple of minutes going over there. And also, we have one of our panelists is Dr. Akhtar Sherin, who is the professor of medicine at Khyber Medical University and is clinical lead at the clinical trials unit at Khyber Medical University and chief editor of the journal that comes out of the same university. He's the General Secretary of Pakistan Society of Neurology and Vice President of East Mediterranean Association of Medical Editors. And he is also was also president of Pakistan Association of Medical Editors. He has a fellowship in medicine by College of Physicians and Surgeons, and also from the Royal College of Physicians in Glasgow. And he has done extensive work on neurology, internal medicine, and stroke, and has more than 50 research articles in journals contributed as authors and co-authors. So without further ado, I will again request Professor Ziaul Haq to please start his presentation. And usually we take about 40 minutes or 45 minutes for the presentation and then leave the rest of the time for some interaction and question and answers. And Dr. Zaid is here, Dr. Akhtar Hamid is here, and they will be manning the chat. So if you have any question and answers, please put in the chat. And without further ado, again, thank you again for all the speakers and panelists. And Professor Dr. Ziaul Haq, please take it.
Okay, so thank you so much. Good evening to everyone here in Pakistan, in the US, and different part of the world. So thank you so much for a very generous introduction. So we were initially in honor that we were given the chance to speak and present the work which we have done, which we are doing here at the Khyber Pakhtunkhwa province and also all over Pakistan. So I will discuss some of the few slides here. It's basically around the Khyber Medical University, what introduction of the Khyber Medical University. And then Zohaib, Dr. Zohaib is here. He's our director of research. He will present the Office of Research, Innovation, and Commercialization. And Akhtar Sherin, a professor, is here. He will discuss about the clinical trial units. And then at the end, I will again discuss some of the premier 4 or 5 clinical trials which we are doing. without further delay, we'll discuss this, the Khyber Medical University, we came into being in 2007. So you can see the vision of the Khyber Medical University, and this was the sole public sector medical university in the province of Khyber Pakhtunkhwa. So there's a new trend in Pakistan which started somewhere around 2002 or 3. Before us, there were generic universities, as like in any other countries, like Khyber Medical College. Most of us are graduate of Khyber Medical College. So the Peshawar University was there, was giving the degree. So all the medical colleges were affiliated to us. But then it was decided that we don't get enough attentions and we don't get enough autonomy to do advancement in the medical sciences, similarly the engineering and agriculture. So the government came up with the idea of establishing a medical universities. There are pros and cons to it, but that's what we have decided. I think it has worked well in our case. So in 2007, Khyber Medical University came into being, and with the vision that we started with the regional focus, and then we enhanced our vision to be a global leader in health science and academics and research for efficient and compassionate healthcare. So you can see the number of medical schools attached to it. There is, as APPNA people are here, there's a confusion. There is a Khyber Medical College and Khyber Medical University and other universities. So Khyber Medical College is part of the Khyber Medical University. Very proud. It is one of the premier institutes that came into being in 1956. And then 1970 was Ayub Medical College. So these two were part of there were only two medical colleges in Khyber Pakhtunkhwa province. But then in 1998, Gomal Medical College and Sedu Medical College added to it. And there was one private institute, this is Gandhara, is the famous Professor Kabir, established that in the private sector. So in 2007, when Khyber Medical University came into being, so the Khyber Medical College, the Ayub Medical College, Gomal and Sedu, and Khyber College of Dentistry became part of the Khyber Medical University. And they are affiliated with us. We are one medical college in dental in Kuhat, Akhtar Sherin is working. That is one of the constituent part of the Khyber Medical University. But all others are the affiliated medical and dental colleges. And then they grow in number. So Alhamdulillah, now we have 27 medical and dental colleges. We have in our large cities of Khyber Pakhtunkhwa, we have in Mardan, we have Nowshera, we have in Swat, in Sawabi, in Dir Khan, in Banu. We all have medical colleges, and also we have 8 medical colleges in private sector. So in dental, we started with Khyber College of Dentistry. That was before Khyber Medical University, now affiliated with us. And then we established a dentistry college at Bacha Khan in Mardan. We established it in Ayub Medical College, and then in Swat, there's a very newly established dental college in Swat, and one at Kuhat. So these are the dental colleges. So overall, we have now 27 medical and dental colleges affiliated with Khyber Medical University. So Khyber Medical University is like we enroll people for them, the students. We take exam, the medical entry exam. And then once they're entered, then we send them to a different college based on their merit and common choice. And once they're enrolled there, then we take the exam. So curriculum is ours, enrollment is ours, and then exams is ours, and degree is Khyber Medical University. But these medical and colleges and their affiliated hospitals, they are autonomous in terms of running these colleges. So the number of seats, you can see that the number of grew in 2000, when we started in 2000, it was roughly around 500 seats. And gradually, you can see that now the number of seats, the medical and dental in the public sector, we have around 1,800. And similarly, 1,500 in the private sector. So in total, there are 3,000 medical and dental students who are enrolled with Khyber Medical University on a yearly basis. So and similarly, you can see that the affiliated institute, then we focus on the nursing, we focus on the allied health sciences. When we started, there was only diploma in nurses, there was only diploma in the paramedics, and there was only no physiotherapy and other structure. So we really established and converted into the bachelor program. And now you can see that we have around 200 plus institutes affiliated with us. The number of students will be happily surprised. We have 50,000 students in MBBS and allied health sciences who are part of this wonderful university. Yeah. So yeah, you can see. So these are the constituent institutes we established in this institute in different part of the Khyber Pakhtunkhwa. Yeah. And you see, then we only focus, we not only focus on the bachelor program, but we focus on the PhD program and the differentiate in the next slide. You will see that the number of PhD program which we are offering, and it's now more than 13 or 14 programs. So these are basically the academic program. You see that the doctoral program, you can see that the public health, there was no public health program all over Pakistan. It was only 2 institutes. Even Zohaib Khan didn't have the doctoral program in public health. So we started a PhD program. Now there are 3 or 4 other institutes which are offering program. And medical education, there was no master's program. We started master's and then now PhD in medical education. Wonderful program. And nursing, the only public sector university in the country which is offering nursing. We have PhD supervisor from trained in Brazil and Liverpool for our faculty, and people are enrolled from Karachi, Lahore, and other part of the country as a PhD in nursing. Basic medical sciences, before Khyber Medical University, there were only MPhil program, and our doctors used to go to Karachi and Lahore and other cities doing MPhil. And majority of our professors, I'll not say majority, almost 100% of our faculty were MPhil program in basic medical sciences, teaching in Khyber Medical College, in U Medical College, and other. But now, alhamdulillah, within the province of Khyber Pakhtunkhwa and Peshawar, we're offering 11 disciplines, and these all are recognized by Higher Education Commission in Pakistan, Medical and Dental Council, which is anatomy, physiology, biochemistry, forensic, public health, and all disciplines we have, alhamdulillah, this MPhil and PhD program. The physiotherapy is a new cadre which we introduce not only into the academic, but also in the clinical services. We started with the 4-year program, and then the Doctor of Physiotherapy, and then the Master's and the PhD. And we created positions of physiotherapists all over the DHQ, the District Headquarter Hospital. And now we can see that the patients are being referred, and even the patients are now going directly toward the physiotherapist. This field, you know, the importance and knowing from the American clinical services, so physiotherapy is so much important. Alhamdulillah, we have now this full cadre of physiotherapists, and we are producing huge number of physiotherapists on a yearly basis. We started human nutrition, dental material, lab technology, oral biology, FCPS in medical sciences. The clinical PhD, I'm one of the committee member in Higher Education Commission. We are 4 people. This was now 3rd or 4th or 5th meeting, and which we wanted to start a PhD program. We are already enrolling surgeons and physicians and cardiologists, but we really want them to do the PhD program. So very soon, inshallah, in a couple of months' time, we will be announcing a clinical PhD program. So similarly, you can see that the masters, so all these program in which you have doctoral, we have masters, and the bachelor, you can see that we have this all bachelor program, alhamdulillah, running very efficiently. So we fill all the gaps in the system. So diploma, nursing into bachelor, into masters, and the PhD. The paramedics, there was only a general paramedics. We introduced 12 specialties. So a boy or a girl, you train in the ICU for 4 years. From speech therapy, we trained them in emergency, we trained them in surgery and cardiac perfusionist. So all these cadres which we introduced, and we trained them for 12 program for 4 years. It's tremendous new cadre enter into our health system, and they are doing a wonderful job. Majority we are leaking them into the Gulf, which is especially in this current circumstances, but some of them are working here, majority of them leave for Gulf, but we are absorbing them as well. We are creating new positions for them. So this is a wonderful achievement of Khyber Medical University. Yeah. So And these are some of the post-fellowship program which we recently started. We ask our, these are the program which the College of Physicians are not offering. For example, they're not offering pediatric urology, pediatric neurosurgery, head and neck surgery, sports neurology, rhinology, musculoskeletal. So those people who have done FCPS, for example, in pediatrics or pediatric surgery, we are offering them 2 years program in pediatric urology. This is with the PGMA, Postgraduate Medical Institute, excellent program. People are enrolling in this. We started humbly, 3 or 4 or 5 people in a specialty, and gradually we will grow as we produce more supervisor in that. Yeah. So the financial health of this university, you may be hearing and you'll be reading in the newspaper, which is very unfortunate. The majority of the public sector University of Pakistan are in financial loss. Our own Peshawar University, you can see there's strikes every day. Balochistan University is closed for the last 2 months. People are struggling with the pay. Only this university, which we took from 50% to 87%, we self-generate. We are not taking a single penny from the Khyber Pakhtunkhwa government. We are only 13% taking from the Higher Education Commission, and the aim objective is that we should reach to 100% self-generating fund in a 2 years time, inshallah. So we're will self-sufficient and surplus budget. Yeah, so this is exciting, the last few slides for me, and then before Zohaib will carry on. You can see there were the medical colleges attached to us and the teaching hospital of the medical college, but there is no university hospital. So we came up with this idea to have a university hospital in which we can really do, we can apply, we can do many trials, you can test different things, different experiments in this. So we need our own hospital in that sense. So you can see the building of that hospital that has been established now. You can see this building is a huge building. We are aiming for about 300 beds hospital within the premises of the main campus of the Khyber Medical University. You can see there are some other pictures in it. Yeah, so this is already done. It's only the finishing part, and we are hoping that it will take another 6 months or so, so that we establish this university teaching hospital. For that, I will be needing support of the APPNA. I'm also trying to visit to US and meet you guys there and generate fund for it. And I think this is something which really need help. We have the funds for this in finishing items. We are doing that, but we will be needing support from all you. So you can see another few pictures of this beautiful building. Yeah, any more? See. Okay, so it's already, it's only the tiling part and others, which is the finishing items. So thank you so much for listening. I will now hand over it to our wonderful Director of Research, Zohaib. We are all working in the Khyber Medical University. I'm the Vice Chancellor, but I have more, the guys who are working with me, they are more talented than me. And I may be maybe lesser in terms of the talent and other, but they have given me the opportunity so that I lead them. So Zohaib is one of them. Then everyone with us is with working with us is a wonderful team. I am so thankful to them for working as a one family. We work as a friends. There's no typical hierarchy, so we work very closely with each other. So I hand over it to our Director ORIC, Zohaib. Thank you, Zohaib.
Thank you, Professor Zia, and thank you for your lovely words. So while our Western counterparts can boast an age of probably that is counted in half millennia or centuries, there is a small university in the northwest of Pakistan which is just 15 years old, but we are punching well above our weight class. And I think, or we feel at least, I feel that our Office of Research, Innovation and Commercialization has played an important role in getting us there. So the Office of Research, Innovation and Commercialization, which in short is called ORIC, is an initiative of the Higher Education Commission of Pakistan. They introduced this initiative for the universities in 2011, late 2010. And ours was one of the first university which was recognized by the HEC as an ORIC. They have certain criteria where you have to have full-time dedicated staff for it. There are certain HR requirements and so on. And I think when we look back, the difference, the things that I'm going to show you in a little while, the difference from other medical universities or general universities particularly has been this dedicated staff, which is there for research governance to support innovation and commercialization. While in other universities, these posts were given on, additional charge basis and so on. Khyber Medical University from the very get-go, and we're very thankful to all the vice chancellors, the 3 vice chancellors that have come before Professor Zia, and then Professor Zia, who himself was a director ORIC 4 or 5 years ago. I think that is a major advantage of Khyber Medical University, that we had dedicated staff. Dishan, if we can move forward. KMU ORIC, as you see, we have a central office at Khyber Medical University, but then, as Professor Zialian mentioned, we have a wide network of these constituent and affiliated institutes, within which we have our satellite offices, 1 or 2 people working, so they are connected with us. Our strategy is to, through innovative overarching strategies, ensure capacity development in research, academics, healthcare delivery system, and informed decision-making in this knowledge-based economy. And then, of course, a lot of you have your roots in Pakistan, so you may appreciate the general lack of research culture that has been, quite prevalent throughout our history. Thankfully, things are changing, but we are striving towards institutionalizing a research culture within the health system and academic institution of KP, through synergizing individuals, our institutions, our network of affiliated and constituent institutes. Also, reaching out to the industry, trying to find synergies where we could help with production of locally produced equipment, as well as consumables and everything. As spoke. Research, NIDAS for KP, we engage with the other provinces as well as the federal health bodies in advancing the research agenda nationally. Next slide, Ishan. So, as I mentioned, we are looking, as our name suggests, we are supporting research and research governance. We are also driving innovation, and we are looking into ventures where we could commercialize all that research that is, being produced by our wonderful faculty. In addition to that, a major focus of the university, because as I mentioned, we're, as Professor Zia also mentioned, we are the sole medical university in the province with a lot of affiliated institutions around. So we have been developing research capacity since our very inception. We had collaborations with the CPSP, with the Postgraduate Medical Institute, as well as the individual hospitals, where we were imparting research education to all the clinical trainees and so on. And this continued for approximately 10 years, a decade of our inception. Can you move forward, Zia? So what our office does is we have this APEX research body which looks after all the research in the university from its very conception to the closing of the projects. This body is called the Advanced Studies and Research Board. Every MPhil and PhD research or faculty research project has to go through this ASRB. Again, a success of Khyber Medical University has been that we are now well into, I think it's the 135th meeting. So one meeting happens every month. And we have had 135 meetings already, which is much more than universities that are decades older than us. So we've been very punctual and very, the frequency has been there to support the students because what happens is that these students send their proposals and then nobody looks at them and they're lying there for months and months. And, even so for example, if there is something, a topic of interest, there is an infection outbreak and so on, and we just sit on it, and somebody does the research once the infection has subsided or the epidemic has subsided, it's of no use. But yeah, that happens. And we at our end at least try to be, get those research proposals out as soon as possible. We also run the university research ethics committee. We give our faculty and students internal grants, as well as, applying for competitive research grants, which I would just touch briefly a little later. There are travel and publication grants. So the only university in Pakistan, and we are very proud to say that, we give our faculty these publication and travel grants. So we, as an incentive to showcase their research for dissemination and so on. We also, in collaboration with other universities, but also just our own conferences. So we have 4, major conferences throughout the year, based on the faculties that they represent. Then industry academia linkages, research capacity development, and so on, the things that I've mentioned. So yeah, again, whenever I see this slide, my eyes light up because we can proudly say that we have one of the highest research budget of any university in Pakistan, barring a couple of private sector universities, which have been doing excellent as well in their own regard. Our revenue is more than 450 million. So that is the money that comes out of comes from these competitive grants. Approximately 250 research projects that includes faculty and students and all collaborative research. More than 200 publications we give, and this is our own money. So 10 million approximately to our masters and PhD students to support their research. So we take fee, but more than that fee, we return to them, giving them support in in getting in procurement of consumables and all that is required for the research. We also give our faculty some seed grants to develop hypotheses and pilot their ideas and so on. So approximately 10 million PKR per year is also dedicated to that, 5 million to travel grants, and then a further 3 million to publication grants. So our current research projects, as you can see, till 2 years ago, our main funding came from bodies outside Pakistan. But when Professor Zia came, he also emphasized that these HAC fundings, although the money might not be a lot, but the prestige that they bring is that also means a lot to our universities, the ecosystem, the higher education ecosystem. And I'm very proud to say that last year we submitted 19 grants and won 12. 12 of them were funded. Last year, the Health Research Institute under the NIH also introduced their new research funding schemes, of which we have gotten 3 research projects. The chunk of our funding, and you could see the currency written in GBP there, comes from the National Institute of Health Research UK, where we have 3 or 4 flagship projects, which Professor Zia would later touch upon. Some excellent work being done there, a lot of capacity development, a lot of, the quest to find answers to our local problems and so on, particularly with regards to non-communicable disease. We have funding from Germany, from the UK. You cannot see the US here, but I know that even right now we are running a reproductive health research project, which Professor Zia is leading, funded by the USAID. Next. So yeah, this is the general process. I think most of you guys are familiar with it. So Zishan, we can move on in the interest of time. So our capacity development the major portion of it, or the major emphasis of it, is through our certificate in health research, where we develop capacity of clinicians who cannot come out of their clinics, by clinics I mean the people working in the hospitals, and those of you who have seen public hospitals in Pakistan could appreciate the lack of time that these people have. So we have this modular program for them, which is a 6-month program, 2 contact sessions, and they get to get familiar with the whole process of research, right from proposal development to the write-up. We also have senior postdoc positions, PhD fellowships, and so on. And these come, it is by the virtue of all these research projects that we have, whereby we are able to offer these positions, which are not necessarily, within a university setup, they are not budgeted otherwise, but through our research enterprise, we've been able to establish these posts, and we're very proud of it when we show these postdocs and so on to our colleagues. And as I mentioned, there are seed grants and publication fee and conference presentation fee and so on for the faculty. So that is also with regards to dissemination. Just a quick glance at our budgets. You could see that we have had a constant improvement. Of course, Professor Zia has had a major role in that. And a lot of guidance comes from him, and we've been very successful lately in getting quite huge grants, unheard of in the Pakistani context, apart from the Aga Khan University, where you can find projects of such heft. But yeah, KMU is doing good when it comes to attracting research funding at the moment. Yeah, just the same figures in a graph. Christian, you can move forward. Yeah, so this is, I included this slide for the people who are, at the moment, there are a lot of young people. I just read some introductions, people up and coming researchers, clinicians, and so on. So the first column is our university funding, that is our faculty research grants. We call them FAIR grants, student research grants, and then travel grants. But this middle column is of interest where, through collaboration with, so there is a requirement from HAC that the application need to come from a university, or someone has to be a university faculty to apply to all these schemes. So we are reaching out to different hospitals, the clinicians who otherwise wouldn't be able to apply to those, collaborate with our faculty members, and then submit grants. And that process has already shown quite a lot of promise. We have won, for example, the biggest grant in our Pakistani context is the Grand Challenges Fund. Only 3 of them have been awarded this year, and one of them is housed at KMU. Then we have the Local Challenges Fund, which are again, and all these are, these GCF and LCF are very collaborative in nature. So sectoral partners, different kind of partners, government, the academia, and so on, they are brought together on one platform as co-investigators and collaborators. And so a very good scheme by the HAC. Then we have the National Research Program for the universities, which is sort of the flagship program of HAC. And this is the program where we've won 11 grants last year. Then HAC has this startup research grant for fresh PhDs, whereby they support them to establish their own groups and so on. Then there is this innovative and collaborative research grants, which are, with the help of the British Council, HAC has established these. All these different HAC schemes are there for people to tap up. There are, I wanted to point this out, that particularly from life sciences or health sciences, there is, compared to the other fields, there is a lack of, applications and applications going in for grants into these competitive grant schemes and so on. And I think it's high time if people, working in the hospitals, working in clinical setups, if they think, because of, all the requirements of the grant scheme, etc., if they are not able to apply themselves, we are very open to match them with faculty members with similar research interests to help support their applications. Of course, they would still be the principal investigators, but Khyber Medical University would support them in getting those grant applications in. Our international funding bodies have been aware, a lot of collaborative research with the low middle income countries is being pushed as an agenda, as overseas development funds and so on. UKRI, MRC UK and IHR UK have been the major funding bodies that we have attracted funding from. We've also collaborated with Khan University on a couple of NIH Fogarty grants. As I mentioned earlier, there is a USAID grant going right now. KfW, the German Development Bank, we are working on the insurance, the social health protection initiative in KP in federal, so the Sehat Insaf scheme. We're looking at evaluations and a lot of interesting work, quality improvement in clinical care and so on. The WHO AMRO, our faculty is, every year there are these small grants from the WHO AMRO office looking at problems of the region, and every year at least 4 or 5 faculty members then get these grants. Can we go forward, Sherin? Yeah, so the challenges, first and foremost, the thing that I mentioned earlier, that all our medical universities, and by the way, there are 18 or 19 now at the moment, maybe that number has already increased given the interest in establishing medical universities from medical colleges. But I think ours is a case for people to learn that, dedicated staff, people who have a research background, they being at the helm of this Office of Research, Innovation and Commercialization really helps further the research enterprise of these, could help furthering in the research enterprise of these institutions. Again, Dr. Zia slightly touched upon it, the brain drain. So, there are a lot of excellent talented people, but they're just, the problems that we have are too much. The opportunities are a lot. They're there for the taking, but there are too few people to actually grab them. It's just, a critical mass that is there, but even that is not, that is not enough at the moment. Again, then we have top-heavy structures, and by that I mean there are excellent researchers at the helm of things. So senior professors, very good clinicians, very good researchers, but somehow we haven't translated all those research skills into a staff working, working in the field, our nurses, our support staff, and so on. So the issue with that is the problem that we see is it comes in the quality of the data and so on. So a lot of a lot of challenges there. I think going forward, at least at our university, we're looking into it as to how we can develop all this support staff to get this interest in research. Then our general malaise in the research culture. So, a very enthusiastic idea, a very enthusiastic researcher. You go out of your university gate and then go to XYZ public sector hospital, and the people sitting there, they do not reciprocate that energy. So I think in general, it's and I put the onus on institutions like APPNA that we need to inculcate this awareness of research and why is it important. And the good thing is people are now recognizing the importance of research. Every day there are young graduates who are coming into our offices to understand how research works, because the UK colleges, maybe the specialty boards in the US, they are requiring, or at least your CV should have some bit of research. So that is good. But again, that is an external sort of motivation. We want this to be more intrinsic. Another sort of hurdle for research in Pakistan at the moment is getting these collaborations. So for example, if one of you gentlemen sitting in North America, we want to have as a collaborator in our research, we wouldn't be able to, from Pakistan, transfer money easily. It's not impossible, but it's not easy transferring money from Pakistan it's okay if it comes the other way around. But yeah, so that has been a hindrance to more collaborations going with countries outside Pakistan. But it's not just international collaborations, on a national level as well. There is some friction, some inertia as to why the medical universities, the 20 or odd medical universities, are not collaborating with each other. Individually, they're doing, I'm pretty sure every single one of them is doing some excellent work. But in health sciences, without collaborations, you're going nowhere. So yeah. Rather than healthy competition is good, but realizing this particular need of research, I'm very glad that we have very strong collaborations with a couple of medical universities, one in the public sector, Rawalpindi Medical University, and then also with Aga Khan University, with who we're running 3 or 4 different global health research projects at the moment. The legal frameworks around research governance, they're still not up to par. When we started, they were non-existent, but the Higher Education Commission and work of individual universities, we have now a lot of legal framework in place that supports good research. But still, there are gaps. There are also gaps when it comes to gender equality, with a lot of females working as researchers, but not in the leadership role. And I don't know if that is just a function of this general malaise of research culture in our country. But in any case, at Khyber Medical University, we are looking, we are actively trying to find a solution to this. And with the support of Professor Zia, I think we've been very successful in getting this gender balance right. Again, quantity is the king, this notion whereby we've set very low standards for ourselves with the number of research papers and so on for promotions and so on. And that is the prime motivation for people to indulge in research and then indulge in poor quality research. As I said earlier, the motivation needs to be intrinsic. We need to find the solutions to the problems that we have in Pakistan. Rather than a collaborator sitting in England telling us that non-communicable disease should be high on your research agenda, we should be telling these people. But I think the onus is on us, the responsibility is on us to take this initiative and inculcate this research culture. I think, Zishan, that would be the end of my stint. Yeah. On to Professor Akhtar Sherin, who is the lead of our clinical trials unit. Professor Akhtar Sherin.
Zohaib, Assalamu alaikum, everybody. We are running short of time as well. Probably 45 minutes are already passed. So I'll just be quick enough because Uzair Saab will be looking for the questions as well and comments of the. Definitely, our research team at university, led by 3Zs, Zia, Zohaib, and Zishan, are doing very well. But the weaker link, in fact, in our research culture, especially in Khyber Pakhtunkhwa, is the clinical research. And we have been trying to establish a clinical trial unit for many years. And initially, we had a session on it during last a few years ago. And last year, we were able to establish the clinical trial unit at the Khyber Medical University, and I'm thankful to Professor Zia and my other colleagues at the CTU, Professor Dr. Saima, and Saima Afaq and Saima Aleem and Safat and few other colleagues who all sat together and just went for it. And we luckily, by the grace of Allah, we were able to establish the clinical trial unit. And for this, I'm especially thankful to all those APPNA MERIT people, especially Dr. Uzair Saab and Dr. Babar, Dr. Bushra, and others who are helping us in establishing and strengthening this clinical trial unit. The clinical trial unit was established with a vision, mission, and objectives. I'm not going into the detail of this because of short of time. But our main emphasis is to establish the credibility of the clinical research being conducted at Khyber Medical University and its affiliated and other colleges and constituent colleges. Because we believe in research integrity and good clinical practice, and also to make it reliable and acceptable to all the other people. Next slide, please. Now we have established a CTU. Dr. was there and Professor Bhutta visited last year, a few months ago, and we have a very good clinical trial unit, although it's not as per international standard, but we are hoping to establish it as a excellence center of excellence. And we have currently have one office, and then there are a few research assistants, and there's a public health reference lab, pharmacology lab, metabolic lab, and genomic lab. So we are backed by very good diagnostic centers. And the team is there. There's an advisory board, there's a steering committee, there's a director and data managers, and the clinical trials managers. For each trial we have a different manager, and we have then method specialist and biostatisticians. And these are there not only to help the clinical trials being conducted, but they also extend services to the other researchers who want some help in the methods or analysis or in the writing as well. Next, please. Now, these services are extended not only to the clinical trials being conducted at Khyber Medical University, but these are also to the 27 affiliated medical and dental colleges. And not only to the medical colleges, but we have been approached by different societies like Pakistan Endocrine Society, the Pakistan Society of Neurology. They are asking for help, and we are going beyond the boundaries of Khyber Pakhtunkhwa, and we are extending our help, especially in designing the clinical research for them, and we are hoping for some collaboration with other societies as well. Next, please. Now, different services have been provided. We have been providing the training workshops for the affiliated and other faculty members, especially for the clinical staff. And we have been running the certificate course. Certificate in health research is the one of the most popular. And we have recently started the good clinical practice certificate, GCP certificate, and 2 batches have completed this course. And we are hoping to train other researchers as well. Then we are providing the other, like proposal writing, the sample size calculation, analysis, and results. And these are provided not only to the proper trial registered with CTU, but we are helping the people, as already mentioned, that who are just coming for any particular service, and we are just providing them to make it a good research proposal. Next, please. Now, basically, there is no data sharing policies in Pakistan, and we believe in data sharing, and we are helpful. We are hoping that we will establish some data sharing repository, that there should be some repository that we will share the data. And we have some policies regarding this, and data are coming, and so to make it the research integrity possible for the robustness of the data, as well as availability of the data for some secondary analysis as well. Next. So clinical trials, basically, I'm not going into the detail of these different trials. These are the trials which have been completed. There are 22 clinical trials which have been completed, and they have been registered with the clinicaltrials.gov. And Khyber Medical University is one of the few universities which have registered their trials with the clinicaltrials.gov. For further trials, next, please go ahead. These are the different trials, and for the sake of, in the interest of time, not to the detail of this. Next, please. So these are the 22 trials which have been completed, and now I will hand it over to Professor Ziaul Haq for just mentioning the some flagship trial at a glance, which have been conducted in clinical trials unit and at Khyber Medical University, and he will then wrap it up as well. Thank you very much.
Thank you, Akhtar Sahab. So I will just take a few more minutes because we are already past the time. So Zishan, you have to help me in finishing this. So this is The first one, which we are saying, this cognitive therapy for depression and tuberculosis treatment. So as Pakistan, we have NCDs, we have also the infectious diseases, as we are focusing on both. And we are focusing on mostly on the multimorbidity, because at this time we are managing diseases, not the patient. So we forgot about the patient, we are only managing disease in isolation. So this new paradigm we are bringing into our clinical services. This is a very important, and you can see the amount of money. This is 4.8 million pounds. We our alumni, this from the Kiel, and also from the York University, we have working with Professor Kamran. Very thankful to him, Professor Najma, and then Professor Said Farouk there. And there are people, we are not working mostly with the US people. I think this is something, we have very strong presence in terms of the APPNA. We have not exploited that. I think this is an opportunity in which we are discussing. So a lot of work is done with the UK, because we came from UK, and like Zohaib and other came from Germany or Europe. So we are collaborating mostly with them. And this is a very important project which is going on not only in Pakistan but also in Afghanistan. So we'll go to the next trial before giving the details. So the next trial we see. Yeah, Zohaib, Zishan, the next one, yeah. Yeah. So this is another one, very interesting one, the Hope project, in which the traditional healer. You can see that in Pakistan, especially in the Khyber Pakhtunkhwa province, you know that mental health is in majority that is treated by the traditional here, the Peer and Maulana Sahab. People consider it as a stigma. They are not coming into the psychiatric clinics, psychiatric ward. Once they come, they are labeled with this disease, mental health issue. So they're avoiding this and going into these people. So if they're going into these people, why not to see what they are doing? So this is a very important project, again funded by the Medical Research Council UK, and you can see that how difficult it is to win a project from the Medical Research Council. They reply from all over the world, and we learned a lot from them. We called these. We first came to know how many of them, and it was a surprise. They do the OPDs. These peers, they do proper OPDs. They give appointments, and some of them see more than 500 patients in a day, in a single day, and they have the wards and they admit people. So we are working now with them, learning from them what they are doing, and also teaching them. So an excellent project which we showcase in our recent public health conference. Yeah. So the next one, yeah. Yeah, so again, this is stunting prevention project, and we see that 44% of our children's, they are stunted. Amazing, amazing. And this is what the Imran Khan showed in his first address when he became the prime minister. But then not a lot of work has been done. So what we did that from the World Food Programs, we developed a food sachet, which is worth around 15 Pakistan rupees. You can easily give them in any mix, in the liquid and the solid form. And we found that it really works. And the trial results we are now publishing. It was a huge trial. There was more than 7,000 people, the children that has been followed right from the third trimester of pregnancy up to the first year of age. We gave the session, and then we followed everyone. So it was an excellent study, and the findings which we'll be sharing very soon. There are 4 or 5 PhDs which came out of this project. So a very important one. And now we are introducing it to the nutrition department. Yeah. And so maybe the last one, you can see, yeah. Yeah, again, so this is a diadem. This is, you see the 3 million pounds NIHR funded, and this is the diabetes, and a huge issue in Pakistan. We can say that this is every 4th person is diabetic. And the sad part is majority of them, they don't know their diabetes. So we are working and the management of the diabetes, and also covering the depression part of the diabetes. We started this huge project in the Khyber Pakhtunkhwa and also Rawalpindi, and we are working, and the same trial is going on in the Bangladesh and in the UK. So it's a very important project. So we are focusing more on the diabetes now. Yeah. So this mental health issue of Pakistani frontline health worker and their management through the health intervention. So we are working, see that if you see the next part, the next slide, see, Ishan. So the common, you can see that we are, so the video training module for the frontline workers. This is something which has never been done before. And that's why, so the beauty of the Khyber Medical University and its contribution, yeah. So this is an ongoing trial now. Is shown. Again, you can see this is a big project. We are going out with the Ukraine, UK, and Abbasin Foundation. And this is again in the nutrition, and to see the zinc and iron deficiency is a big problem in Pakistan. We developed the wheat, and we put the zinc and iron. We're working closely with the agriculture university and agriculture people, and the findings of this trial has been now concluded, and it's in the process of publications. Yeah. So there are many more projects. For example, one I will be mentioning is that we work with ICRC, maybe the ICRC colleague here. That is violence against healthcare worker. We know that violence against healthcare worker is an issue. So what we did, that we first did study not only in Peshawar but all over Pakistan, and we found that every second person, every second healthcare worker has experienced or witnessed violence. So we developed this data, and we published a lot of publication out of this. Then we work side by side with the government. Then we found that there is no law. So we work with the KP government, and we establish a law, and act has been passed. We are now in process of implementing. Now the Sindh province and Punjab province are following that. The Sindh also passed this law from their cabinet and also from the assembly. We are then working with the patients at why we also developed the curriculum, the communication skill. We found a lot of areas in this. This is why this violence is happening. One important part is the communication skills of our doctors. So similarly, the effectiveness of vaccine study, this is directly done by the EMRO WHO, one study here and one in Iran and one in the Europe. So this is, we are following a lot of healthcare workers who have have the vaccine, the COVID vaccine. We are following them, and the antibodies and the readmissions and the re-COVID infection. So this study has also been concluded. So you can see that there's a lot is happening in this province. The Khyber Medical University is shown a tremendous response, and it also shows that if a public sector can come out of the traditional government sector, and it make the business easy with the donors and other co-workers, then they can do a tremendous work. So I'm very, very happy and proud man to be part of this wonderful. Thank you, Zersa, for hanging. Thank you so much. Yeah.
Thank you so much, Sir Dr. Zohaib, Dr. Hamid, and rest of your team, Dr. Sherin, for a wonderful overview, and it's very impressive portfolio of clinical research that you have managed. And it seems like Dr. Rozair was really impressed by when he visited your university. So unfortunately, we are over time. So maybe Dr. Rozair, maybe you can say a few words, and because we already passed over time.
Thank you very much, Dr. Sarfraz, and thank you very much, Professor Ziaul Haq, Dr. Zohaib Khan, Zishan, Dr. Sherin, and Dr. Akhtar Hamid for joining. So just we will have just a couple of very quick questions. So there is a query that I have a query. If there is any program offering PhD studies in neurosciences, endocrinology, energy, and metabolism. So that's to Professor Dr. Ziaullah.
Yeah, Professor, I think I already answered that we are now taking people, we are working in this neurosciences and anatomy department and the physiology and biochemistry. But if you specifically name it as a PhD in neurosciences as an endocrinology, that has not yet been allowed by the Higher Education Commission of Pakistan. So we are working on that, but there are a lot of projects. For example, the diabetes we are working, it's an endocrinology. We're working on the neurosciences, the mental health, and also in the basics and clinical sciences. So a lot of this area has been under research, and different PhD students are enrolled. But to name it as a PhD, and this maybe this is in process. Yeah, and I think the clinical PhD is also in process with the Higher Education Commission.
Excellent. So the next question is, what research opportunities are currently provided to the medical student of different affiliated medical colleges, because there is a group and they claim that they are very enthusiastic researchers and they are interested in field work. So with your affiliate colleges, do you have any such option?
So Zohaib, you can answer, yeah.
So the thing, I think when Professor Bhutta and you visited KMU, there were discussions about this mentorship program for undergraduates. We are actively looking into it. In fact, we have now devised the modalities as to we will have a competition whereby we will select people who will get mentorship as well as research support and monetary support for a few for their research ideas. At the moment, our support, mostly monetary support, at least goes out to our affiliated undergraduate institutions. But having said that, there are multiple groups working with our faculty members in their research groups where they are supported and to get the know-how of the research process. I'm mentoring 2 groups at least from colleges that are not within that are not our constituent institutes. So yes, there are opportunities and there are further coming down the line.
Excellent. Dr. Akhtar Hamid, thank you very much. I think you are a pediatrician and there was some interest about the stenting and you are doing some job here in work in North America. Would you like to comment really about your experience and collaboration with the Khyber Medical University in any way, please? Over to you.
Thank you. First of all, thank you, Professor Dr. Ziaullah and Zohaib, giving us a nice overview and of the Khyber Medical University, along with the affiliated colleges, as well as your clinical trial unit. Before I answer that, I would like to hear from you. One thing is that all the researches you're doing, are you trying to promote, especially the randomized controlled trial? Because the most of the research I'm seeing is cross-sectional or something more field-wise. So number one, in terms of my, I was trying to do this stunted growth program in a little bigger children, including there are 4 areas to look into it. And not only the first 300 days of life. So I was looking for the children who is already past 5 years or so and see if we can reverse them or not. So that's the thing we have tried to do, work with some doctor across, including Zohaib Khan and other people who's around that. So it's everybody knows that the first year of life, you can bring them back faster than if they are after 5 or 6 years of life before their puberty. So I'm yet in a process of doing that and would like to have a connection if in future. But if I could hear from you that, because in Pakistan, that randomized controlled trial seems to be on the bottom, and I'm hearing from a bigger perspective from the medical university like Khyber, which is amazing to hear your profile. So please comment.
Yeah, thank you. I think what the research study which I've mentioned, all of them were clinical trials, and all of them are funded by NIHR and MRC. They're break trials. For example, the stunting, which you are saying, we followed that for 3 years, 7,200 people. All other studies like diabetes and depression, the tuberculosis, and they're all clinical trials. So we are not for cross-sectional study, you don't get this much amount of money, and especially when the funding agencies in IHR and MRC. So almost all of them are clinical trials. For the first, you say the stunting beyond, so we are focusing now on the first 1,000 golden days. And because the problem is too huge here in Pakistan. But if something, and that's what the evidence tell us, that if you focus on the first 1,000 days, this is the most fruitful. But you gave us some evidence that is beyond that, it can be reversed, and of course we will be working on that. Yeah.
Thank you.
Thank you very much, Dr. Akhtar. So I think we have already passed like 8 minutes. So I do not have really word to express my gratitude and compliment to Professor Dr. Zia and his team, which is very encouraging. And, you know, there's an island. Who could imagine really having so much work, and they are rubbing their shoulder with Khan University from the extreme north. That's really phenomenal, and all the accompaniment. And thank you very much for sharing your success story, your pain point, and so many things, and your team. We are extremely grateful for sharing, and phenomenal work is going on. And we are extremely thankful to the participant for their time, dedication, and the team who is managing the webinar, the technical team. We are thankful. The recording will be available shortly on the YouTube channel from APPNA MERIT, and we will send you the link. So without, spending more time, once again, thank you to all of you, and all the best wishes from our side, and have a wonderful weekend and all the best. We were really worried about the internet, and I was praying that the internet is working. We are really very concerned about the webinar. We were not really willing to miss this opportunity to learn and know more about Khyber Medical University. So with this, we close this session. Thank you very much to all of you, and all the best wishes from here.
Thank you so much. Thank you so much. I love it.
Thank you.
Thank you, everybody.
Thank you.